Hey everybody, it's Dr. Brace here for Facial Plastics Friday, continuing on our blepher brow lift topic from last week. And today I want to focus on brow lifts specifically and what kind of brow lifts do we do or should we do. It's a great topic because there's lots of different ways to do a brow lift. In the past, brow lifts were done by what we call a bicoronal incision. So an incision across the scalp from ear to ear, lifting up the entire thing, taking a strip of hair-bearing skin out and lifting everything up. As you can imagine, you're lifting from far away, and so you're lifting quite aggressively to try to get the brows to come up. It leaves a scar right across here, and it can make somebody look a little surprised or in shock. Brow lifts can also be done with a trichophytic. Trichophytic means a hairline incision right along the top of the forehead, and a strip of forehead can be removed, and that as well would lift the brows up from up here. And that's a great traditional way to do a brow lift. It gives you a really consistent and reliable result, but it does put a scar right across the hairline, and that really bothers some people, and it also creates numbness in the anterior scalp. So how else can you do a brow lift? Endoscopic brow lifts were quite common, and variations of them are still quite common, and that's where you make little tiny incisions in the hair-bearing skin, and using an endoscope or a little camera, go down and release the whole brow, and then lift things up and then tack the brow down to little anchors in the skull. So we can't get these in Canada, but a lot of my colleagues in the US would use something called an endotine, which is a little, almost like a carpet tack that you insert into the bone, and it has little spikes that then would hold onto the skin and hold things up, and they dissolve over time after the brow has scarred and healed in place. They're not Health Canada approved. We can't get them here in Canada, so there are different ways to do that. I like using bone tunnels, where we drill a little tunnel through the outer table of the skull. The skull has an outer table, an inner diploic layer, and then an inner table. So you can actually make a little tunnel through that outer layer and secure a suture and then tie the brow up to that, and that would hold it up in place. And when I do that, I don't actually use an endoscope, and I do a variation of an endoscopic brow lift called a temporal brow lift, where the incision is right here in the hair, just in behind the hairline, and we're lifting the brow up and out. So it's a type of brow lift where it's not going to make you look shocked and surprised, but it's going to really open up the corner of the eye where most people have fallen and rejuvenate your eye that way. It's a little tiny incision, usually 2 centimeters at most, and it heals beautifully. It holds the brow in a really reliable position. But in my practice, that involves going to the operating room, and a lot of people don't want to have a general anesthetic and go to the operating room. So for those people, we can do it right here in this room. We can do what's called a direct brow lift or an indirect brow lift. A direct brow lift is where you make an incision right along the eyebrow hair and remove a strip of skin right here, and you lift the brow up directly above the brow. Now that puts a scar along the eyebrow hair, but if you have thick brows or you microblade, you'll be able to camouflage that scar. We also treat it with CO2 laser, a pulse dye laser, and silicone, and we make it look as good as possible, as quick as possible, but you do have a scar there, and that's what it costs. If you want to avoid a hidden scar by going to the OR, you can do it right here. If you're a man, in most cases it's a man, I guess it could be a woman too, but if you're a man that has really deep forehead lines and you're not going to use Botox, well, you can do an indirect brow lift where you actually hide the scar in one of your deep forehead lines and lift the brow up similarly by removing skin from the forehead. And so those are the main ways that we do brow lifts. If you wanted to go to the OR and wanted to have everything hidden in terms of incisions, it's a temporal brow lift with an endoscopic approach. If you really had a tall forehead that you wanted to bring your hairline down and you wanted to get your brows up at the same time, then I would do a trichophytic lift along the hair. If you want to avoid the OR completely, I would normally do a little incision along the hairline and do a direct brow lift. And I love that approach also for somebody with a real asymmetry where one brow is up and one brow is down. You can get better symmetry by directly lifting the brow that's lower. So those are the ways we do brow lifts. They're almost always a fantastic adjunct to do with a blepharoplasty, and they really rejuvenate the eye by making it look refreshed, more open, more relaxed, less tired, and really just helps the person's face look more rested. So those are brow lifts. Send us your questions if you have any, and everybody have a great weekend.